my name is Alexis Polly, and I'm going to be doing a presentation for you today on anencephalic organ donation, what that means, and exactly what the ethical dilemma is with this issue. So what is anencephaly? First off, anencephaly is a failure of the neural tube to spontaneously close at the cranial ends, and this means that the brain does not develop. So anencephaly really translates to no brain. This condition is incompatible with life. So a lot of times babies with this condition, they might make it to birth, but a lot of times it's either a miscarriage or a stillbirth that happens. Other times they might live to be a day, 2 days, a couple days, up to a week old. Rare occasions, they might make it a year or two. But in all reality, it's just a very incompatible with life issue. Right here, you have a baby, a fully developed newborn, what a newborn should look like whenever they're born. Here's the head and the skull. You have your brain and your brain stem. Over here, this is a newborn that has anencephaly. So they have where that normal skull line should be. They don't have the full brain going up to that, and there's no skull line. It's just open. And there's the brain stem, and here's the underdeveloped brain. Sometimes babies are just born with no brain at all. It's just very, 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 very little, if any. And it normally happens between 3 to 4 weeks of age. Whenever all of this is developing, they'll be able to tell. And I'll go over diagnostic testing and ways to diagnose this condition later on. But what it is, it's a type of birth defect that occurs in the baby's brain. In the skull and scalp, it does not develop in the wound. So babies are born with this condition. Like I said, it might be a few hours or days, but you can lower this by lower this chance by taking folic acid early in pregnancy and some other things that we'll go over. So this is a fetus. This is an ultrasound of the fetus in the womb. And right here, you can see the absence of the cranium. You have like the baby's little face. And right here, there's no head that closes, no skull. This is what a baby looks like with this condition. See, the brain's fully out. The head didn't form around the brain like it should have. It's just a very, very sad occurrence that can happen to a fetus and baby. So, like I said, causes of anencephaly, it might include the lack of folic acid. So a way to prevent this is to make sure you're when you're pregnant, eating your green leafy vegetables. Well, you should eat those always, but especially when you're pregnant. Also taking your prenatal vitamins that your doctor prescribes and he recommends. That's very, very important because your baby needs those nutrients. Another incidents that could cause this would be diabetes, high body temperature, and I don't just mean a fever, I also mean using a hot tub or sauna during early pregnancy and getting your body hot and overheating your body and making the body temperature high. Medications such as anti-seizure drugs, some migraine and bipolar disorder medications can also cause this condition. Obesity, so excessive body weight, and then opioid use. Whenever I say opioid use, I do not mean just illegal drugs that are opioids. I also mean like hydrocodone and stuff like that, like codeine. Those kind of things could also cause this condition. So let's go over what organ donation is first before we get into the dilemma. So what is organ donation? Here are 3 facts about organ donation. So first, one person can save 8 lives and enhance 75 others through organ, eye, and tissue donations. On average, 150 people are added to the nation's organ transplant waiting list each day. So that's 1 every 10 minutes. That is crazy to me. In the amount of time it takes me to make this video, there could be 1 solid person, 1.5 people added to this list. Nearly 114,000 Americans are currently waiting for an organ transplant, and an organ transplant is their only remaining medical option. So without that organ, they don't have much hope. So that's why it's very important to donate your organs if you can, to keep somebody alive. And then I found this little fact about neonatal babies and organ donations for them. So organ donations from a neonatal baby, so it's a baby under 28 days old, is incredibly rare. In 10 years, just 40 babies this age have become donors, according to the NHS Blood and Transplant. 26 donated tissue, heart valves, corneas, while 14 donated other organs or both organs and tissues. So what exactly is the dilemma here that we're facing and the point of this whole presentation? So here's the dilemma. Given this diagnosis of anencephaly, this does not allow the baby to have a fully developed brain. If the baby makes it to full term where the baby is born, then, and it's not miscarriage, it's not a stillbirth, and the baby makes it full term, these organs inside of this baby are good organs most of the time, if not always, and they are able to be donated to a baby and an infant in need in a family that needs those organs, because that transplant list is very, very big. However, with the donor or the dead donor rule, it states that the vital organs should not be taken from a patient who is living. It can only be taken from a patient who is deceased. So with that being said, pretty much what that means is I can't have a 4-year-old daughter who has cancer or a 4-year-old daughter who needs a kidney transplant, and then have a baby specifically only to give that daughter of mine, the 4-year-old, a new kidney. Like, I can't have a baby just to take the baby's organs. That's unethical. However, in this situation, these parents know that the baby is most likely going to die within a couple hours, if not a week. Rare chances it might make it a couple years. Very rare chances. And it's very sad to think of it like that. But these parents know that their baby didn't develop correctly like it should have, and yet they still had the baby. And a lot of these parents just want to be able to donate those babies' organs to somebody in need. And so that's the dilemma. Should these parents be able to donate those organs, or is that completely unethical and not okay to do because the baby is technically living? So here are some ethical concerns that we have with this situation. So it's been a debate around the 1980s, 1990s. So all of these listed here are from 1994. And these limitations, they caused, like I said, spread through the 1980s, 1990s. And it was debating if, this is ethical, this is not ethical. And the debate is that, all of these babies could potentially save people's lives. They could help cardiac, renal, liver patients, and the desire to give meaning and benefit to the anencephaly infant's family were presented as justification for change in the medical standards and the law concerning death and organ donation for these kind of infants. So in 1994, it was all good. Everybody agreed that it was ethical. They faced certain death, usually within 3 days. They lacked consciousness. Parents wanted to donate these to help others, like I stated, and this deemed ethically acceptable. However, later in 1994, there were new objectives that were given and discussed by council, and they summoned up the 5 objectives. They were pretty much saying, this is unethical. Some of these babies could live. Why don't you try to put them on medications and a ventilator? Why don't you try to give these babies some hope? Don't just kill them to give away their organs just because you don't think they can have hope because they don't have a brain that's underdeveloped. So these were all of the things going on in 1994. And then parents, should use other measures to keep that baby alive and let it die naturally. So at the end of the day, everyone knew, they didn't know, but they were very convinced that this baby would not make it, even with the medications and ventilators and, life support that this baby was going to have to be on. And a lot of people don't want to see their baby like that. Just in my opinion. So if the mother or father wanted to donate the organs, again, this was the debate that was going on, and never experience and will never experience consciousness. So the baby has an underdeveloped brain, if it has one at all. It's never going to experience consciousness, and it will never experience consciousness. So that is a lot of the issues. The baby may wake up and the baby might be alive and well, if it's a day or 2 or weeks or a year or so, yes, it's going to wake up. It's going to have consciousness, but is it actually going to understand everything going on with that underdeveloped brain? So that was another debate. So here are just some facts about this condition. So 1 in 1,000 births result in anencephaly. 7% die during pregnancy, 20% die during delivery, 50% only live it between a few hours and a day, 23% live more than 1 day. So that is crazy to think of. 1 out of every 5,000 to 10,000 babies are born with this condition. It affects girls more so than boys. It usually ends in miscarriage or stillbirth, as I've stated, and in women who have previously had a child born with NTD, which is a neural tube defect, such as spinal bifida, they have a higher chance of conceiving a child with anencephaly. So who all is involved with this condition? You're going to have your parents who have the baby. You're going to have the baby, the newborn, the doctors, because you need 2 doctors who are not on the transplant organ team to pronounce the baby dead in some instances. But then you also have the baby doctor who delivers, and the doctors, the OB, and all of those who are used throughout the pregnancy. So the debate goes back and forth. So that's why I said not just the 2 doctors. The organ transplant donation team, you also need them. If it does happen that the organs can be donated. And how is this diagnosed? Well, it might be diagnosed through amniocentesis. It might be diagnosed through the physical exam after the baby is born. It also might be diagnosed through the prenatal ultrasound that I showed earlier in my presentation, and also by a blood test called quad screening. So quad screening is a maternal blood screening test that looks for 4 specific substances. It is AFP, HCG, estrol, and inhibin AFP. So this is alpha fetoprotein. It's a protein that is produced by the fetus, and the HCG is the hormone that's produced whenever it tells you if you're pregnant or not. So all of these tests together in that quad screen and the 4 tests can help to determine if this baby does have this condition. And it is recommended that every pregnant woman get this test. So the importance in my stand, I feel as though if a baby is born in this condition and the baby does not have time or a meaning, I'm not going to say a meaning behind the baby's life, but if the baby makes it full term and the baby has this condition and the baby's head is not fully formed and the brain's underdeveloped and it only has so long to live, and the parents are wanting to donate that baby's organs and get their closure and try to help another life, then I feel as though those parents should be able to donate those organs. And if the parent decides that they don't want to donate those organs, then they don't have to donate those organs. If they want to wait it out and see if this baby has a chance and this baby lives a year or so or longer in rare instances, then that is very good for that baby, and that baby is a miracle. And if those parents want to go back and donate the organs early on as soon as the baby is born, those parents and that baby helped another baby, hopefully. And I mean, that's where I stand on it. And the importance of this is every life is beautiful and every life deserves a chance. So if there is a baby who has made it to birth and the parents want to donate those organs because they don't feel as though their baby has a chance anymore, then let those parents donate those organs. The dead donor rule should not apply here, because the dead donor rule, it's for having a baby just to donate the organs. These parents didn't ask for this. They didn't ask for their baby to have this condition. They didn't have this baby with thought that, oh, I'll donate all the baby's organs to my 4-year-old because it has this condition. Or they didn't have the baby just to donate the organs. They had a baby. The baby has a condition. That baby is not going to live very long. And those parents want to help another soul. So every life is important. So if you have a baby over here that's dying, regardless, most likely, why would you not donate those organs? And here are my references. Thank you so much.